What's up, guys? It's Dr. Murphy with Murphy Medical Associates and our team, coronatestct.com. I know it has been a little while. It's been a little while, but Delta's here, so now it's time to open up a can, get our sites running, and kick Delta's butt. That's right. That's what Dr. Murphy and the team at coronatestct.com are going to do. Have no fear. We're here for you. And you're watching Murphy's Medical Minute. All right, guys, I want to get over a couple of things here. I want to go over some stuff with you. Today's date is July 30th, 2021. Where were we a year ago? Well, at this time in July, we were getting news reports about how horrible the turnaround time was with PCR tests. And that really was the gold standard test. People were trying to push a couple other different tests, and the data on the Abbott machines was horrible. They reformulated it and reviewed it, and honestly, now the Abbott machines are a little bit better. So we really only had a few labs in the nation doing COVID testing. So turnaround times were high. Why? Not because we had a massive burden of COVID in the Northeast at the time, but because Florida and California and Arizona were on fire. Well, guess what? Now it's Louisiana, Missouri, Arizona, California, and that's right, Florida again. But what has us most spooked right now, I can tell you, it's the Delta variant. And the Washington Post flipped the government upside down on its head with stuff that we've known for a long time. What? Yes, stuff that we've known for a long time. Public Health England has been putting out some data about its soiree with Delta. And what did we find? We found that it was more infectious. We found that they had higher viral titers. We found that they were infected quicker. We found in the Israeli data that vaccinations are not sterilizing. If anything, people who got vaccinated we're experiencing breakthrough. In the United States, the CDC decided only to test breakthrough cases of those who were truly so ill that they ended up in the hospital. So what happened? Testing fell off a cliff. The president revoked the mask mandate for the vaccinated, opening up air travel everywhere, lighting the South on fire, as we knew was going to happen with indoor events without masks. It was just obvious. It was just obvious that that was what's going to happen. So much so that when you take a look at, let's see if we can pull it up here. I'll pull it up and see if I can switch over for you guys. We'll switch to the transition to the screen here. I don't know if you guys can see this, right? I'm going to take a look at it. This was a review of the estimated case range over a 7-day average per 100,000. So you can see the South, Florida, Louisiana, Missouri, Arkansas, Nevada. What are you doing going to Las Vegas, guys? Honestly, it's the same thing that happened. I had in early July last year, I had a phlebotomist and a nurse sneak off to Jamaica. Why? Because it was cheaper than you could ever get out. And that's what's going on with Las Vegas right now. So let's take a look at our numbers. They're going up. There's no doubt about it. There's no doubt about it. Say, yeah, but numbers are up. But what about the vaccines, right? What about vaccination? So let's overlay it with vaccination. And as you can see here in the states that are darkest green with a higher percentage of people vaccinated, yes, let's take a look. Side by side, I think it's a good thing to take a look at here. We can see the more vaccinated you are, the less cases are there. Well, one of the problems that we have is that the federal government has said, if you get a sniffle, don't worry about it if you're vaccinated, because it's probably not COVID. That couldn't be further from the truth. That couldn't be further from the truth. And when you talk to Dr. Scott Gottlieb or myself, I'll tell you that we've had a horrible, horrible, horrible drop in testing. Our numbers have plummeted to the point where many of the testing sites, our testing sites, Yale's testing sites, CVS's testing sites, Hartford Healthcare's testing sites, and the federally qualified health centers, they have no testing sites left. So if you can't get tested, then truly, like former President Trump said, the numbers are up because the testing is up. Well, the numbers are down because the testing is way down. That's right. Testing is way down. So we are once again flying blind. No, let me rephrase that. We're flying with one eye covered. We're the one-eyed guy, right? So we are one-eyed right now. There's no doubt about it. We're one-eyed. So that is the vaccinated relative to the infected, and all that it really is the vaccinated relative to the tested. Tests are way down in the Northeast, way down in the West. And because they're so far down, we really don't know how bad COVID is, especially since the CDC did not advocate testing for vaccinated patients who had exposure. They didn't advocate again, and that's just insane. So here, let me bring up another one for you guys. Let's see here. Oh, there it is. This is what I wanted to see. So I don't know if you guys can see this. We're going to take a quick look. All right? I can't really highlight it. So this is presented to you in all its splendor from a leaked internal PowerPoint disseminated at the Centers for Disease Control. It's from the Centers for Disease Control. And I can tell you, after working with state and local governments and my brief soirees with the federal government, I can tell you this. It's about optics rather than medical care. It's about optics rather than medical care. If they can make a good optic here and still get the mission accomplished, that's what they're going to try and do. They're going to try and position paper this, so to speak. Unfortunately, that should stick at the politician level, if you want my honest opinion. That should stick at the politician level. That should not be at the public health level. But unfortunately, at all of these organizations, politics is trumping healthcare. Wealth is trumping health. And we have to have more, we have to stop this Trump stuff. We have to stop this Trump stuff. And in internal communication, the CDC reveals the following, that this Delta variant B.1.621 is the one of the Indian isolated Indian variants, is more transmissible. And by the way, it ripped the UK apart. So it's not like it's just an Indian phenomenon, although I showed you pictures about what was going on in India way back when with the Delta variant, and the fact that the crematoriums were piled up with funeral pyres. So we knew this 2 months ago, 3 months ago. I think maybe 4 months ago, I started railing on the variant B.1.621 and B.1.617. So the Delta variant, as we call it now, because we don't want to offend anyone, which frankly is a little ridiculous, but I'm going to follow their lead. The Delta variant is more transmissible than MERS and SARS. Well, that's fine, because the old variant was probably more transmissible than MERS and SARS, and that's why it spread everywhere. More transmissible than Ebola. Yeah, I assumed it was more transmissible than Ebola before when we were donning pappers and in hospitals. More transmissible than the common cold. Well, that one also I knew. It's nothing off the wall. More transmissible than the seasonal flu. Absolutely. I knew it was more transmissible than the seasonal flu. Unfortunately, people kept pushing this off and not admitting that. So nothing has changed between Delta and SARS-CoV-2 wild type or the UK variant, Alpha, before. Or smallpox. Well, I haven't seen smallpox, so I can't tell you how quick it spreads. But I can tell you that this Delta variant is definitely, I repeat, definitely spreading way quicker. spreading way, way, way quicker than just about everything I've seen. And the CDC acknowledges that and says it's probably just about as transmissible as the chickenpox parties. You guys remember the chickenpox parties back before Verivax? They would have a bunch of kids packed together in their PJs and a sleepover when one kid had chickenpox, so that way they all got immune, so that way they wouldn't have to suffer through it and they had a lower viral load. That's that. Interestingly enough, it's not as contagious as measles. Not as contagious as measles. If it was as contagious as measles, we got a problem. And let me tell you right now, the next variant up is the B.1.621 out of Colombia. And that has a furin cleavage site mutation as well. That's like a greatest hits anthology of variants of concern mutations in B.1.621. And so we just got to watch for that next, and virus gonna virus. All right, so here you go. More transmissible. Well, even with all of this said, let me tell you this. The government said, if you are vaccinated, you can ditch the mask. If you're vaccinated, you can ditch the mask. Now, I want to talk to you guys a little bit about this because I think it really matters. I think it's important here with all of this. And you see how I kind of highlighted, like, boo, 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 boo. It's going to ride through here. But sorry, that's part of what I'm going to do. So I'll shrink it for you so that way you don't get mind blown. I'm glad I'm back too, Julie. Look at that. I just got Julie Lotto here. So Julie Lotto. I'm back in black. Ready to go. So I am back, and I am going to try to continue to update you guys as best I can with the new data. Let me tell you a couple of things about the data right now. I'll tell you a couple of things about the data right now. Let's see if I can send this along here while I do this in chat. But first off, I want you guys to take a little read here of, take a little read here. So I don't know if you guys follow me on Twitter or not. You guys follow me on Twitter? You guys follow me on Twitter? All right, so on Twitter, I'm at TakeWeightOffMD, but my our live stream is at Murphy Medical Minute. And so I follow a lot of other doctors. And one of them just kind of hit me. It hit me, you know, it hits just right when Karen Gallagher says, look, folks, a year ago, COVID was novel, and how we dealt with it was off the cuff. That's true. But I personally dug through the science, looked and watched what was going on in South Korea and China. The CDC, I assume, did the same thing too, but unfortunately they botched testing in February, so we didn't have a valid test, and so we had to scramble and find the best tests we could. But more important than that, maybe we could be excused for not having enough lab tests. We could be excused for not having the right protective equipment. We could be excused for not being able to have all the right documentation done. We could be excused for not having enough staff. But why the hell are we not ready now? Why are we telling people to take off masks when we know COVID is airborne? What are we doing? And why are we telling vaccinated people they can take their masks off? What do we think? They're 5 years old and we have to say, you know what? If you go to the dentist, we'll take you for ice cream. Well, what good does that do? If you go to the doctor, I'll take you for McDonald's. We're all adults here. We're all adults here, and we need to be serious. And unfortunately, in this case, do we have mutual aid agreements? Are we ready to deploy hospitals here? The good news is, honestly, I'll tell you, the vaccines probably will prevent from hospital overwhelm. They're not going to prevent, I don't believe, from long COVID. And some simple, small studies now have shown that 1 in 5 people post-vaccination with a breakthrough infection end up with long COVID. And those numbers are very similar to what we see, 20 to 30% for infection. I'm not telling you not to get vaccinated. You should get vaccinated. Vaccines are essential. They are essential for helping us get out of this. But we need more than that. We need NPIs and we need testing. We need testing. Interestingly enough, Jared Wallen said the same thing. Same reason even last year, most of the healers I know were buying their own PPE. Here's a news flash. I'm still buying my own PPE. I'm still buying my own PPE. I'm not going to talk about the fact that they called the administrative leaders of hospitals clowns and they were hiding in their houses. I think there were some admins out there. There were admins out in the field that were swabbing. I saw some of them. And some of the admins also were physicians, physician admins. They were doing the right thing. So now, quick update. Where do we stand in Connecticut? All right, I'm going to show this to you quickly. Here's where we stand in Connecticut as of July. The predominant variant is the Delta B.1.621.2. Secondary variants are coming through, including a subvariant of the Delta. A subvariant of the Delta, Alpha, is getting squeezed out, and I believe we're going to see a bunch of B.1.621 because actively we see it in Florida starting to outcompete the Delta variant. That's what we're seeing. That's real. That's there. So what are we going to do about it? What are we going to do about it? I think that we need to be honest with ourselves. I think we need to be honest with ourselves. And so I'm going to leave you with this. Simple. Yesterday, I spoke to a patient. And by the way, I've been doing all these positive calls for our departments of public health, and I'm doing positive telemedicine visits with all of our positives. Yesterday, I took care of a patient who received both doses of Pfizer vaccine, who went to dinner at her parents' house, who both received 2 doses of the Pfizer vaccine, and had a nice dinner with her brother, who lives in a group home, who also had both doses of the Pfizer vaccine. During that couple of hours of dinner and interaction, the brother was positive and gave it to the sister and to the mother and father. So do you understand what happened here? Vaccinated patients gave it to other vaccinated patients. That's no surprise. And frankly, I think if we were properly testing the vaccinated patients, we would have seen that already. Unfortunately, the CDC has said, yeah, if you're vaccinated and exposed to someone, go spread it. What? No, they said, yeah, you don't have to quarantine. You don't even have to test. Until this. A massive outbreak in Massachusetts in Barnstable County, where we identified that patients that were vaccinated had the same viral load in their nose as those that were unvaccinated. All right, I'm going to say it to you again. And I'm going to say it to you again with a very serious look here. Very serious look. All right, this is Dr. Murphy's serious face. I'm going to take my serious face. I tend to clean my glasses when I do this, so I want you guys to understand what's going on here. I got in a hot debate and in hot water. I've entered new channels with Odyssey and with Twitch. I'm also going to work on Facebook, but right now I'm live streaming on YouTube. Why? Because it's where I learned to live stream, and I think they do a good job. Never mind the fact that they banned Michael Osterholm, which is one of the voices of reason and on President Biden's advisory council, but YouTube banned them. Why? Because he used words that caught the attention and an algorithm would locked it up because they're too lazy to have humans listen to his podcast. Too lazy to have humans listen to his podcast. Problem. Right? That's a problem. So YouTube, got to fix it. You got to fix it. No one out there, especially Michael Osterholm, is not giving you information that is incorrect. Information changes. Science changes. The CDC, despite having lots of evidence from Public Health England, went a different route and decided to unmask everyone so they could live their best life. Unfortunately, what we found in Massachusetts is that the vaccinated give it to others at maybe perhaps the same rate as the unvaccinated. So no one should be unmasked. Everyone should wear masks indoors. COVID is an airborne disease. That we've known, that we've seen, and that I've inferred since, since March of 2020. Since March of 2020, right? I've been telling people to mask up, and I'll say it again. The city of Stamford did the best it could for the Stamfordians and fought off a big COVID pandemic, not through vaccination, but through masks. And they've also done a great job with vaccine as well, but they've shut down their en masse vaccination centers. We need more than vaccines. We need masks. And the data that I just saw from the CDC and the leaked PowerPoint, it made it crystal clear. Vaccinated patients are just as infectious and can give it to you just as easily. And the clinical data that I've experienced demonstrates to me that that's probably been the case the entire time. So God only knows how much Delta we're gonna find when we finally start to test, treat, isolate, and trace. Today is July 30th, 2021. A year from where we were waiting 10 days for a COVID test, we now can get them pretty quick. So I imagine if people are scared enough and they're gonna test, the numbers are gonna go through the roof. Julie, you are welcome that I'm being honest. I've always been honest. And that is the only way to be, because it's the right way to be. People are adult enough to handle the data. If you're vaccinated, stop being selfish, mask up. If you're unvaccinated, stop being selfish, get vaccinated and mask up. We may end up in another lockdown. This is Dr. Murphy telling you in a couple of weeks, if we can't get a hold of this and it spreads to the Northeast, we may expect another lockdown. Right now in Connecticut, the Delta variant is roaring and reigning supreme. We are seeing big numbers climb in Hartford, New London, and New Haven counties. It's only a matter of time before it gets to Fairfield County. We're getting in a pincher move this way. I think it's interesting, a pincher move from New York City and New Haven County. We'll be ready at coronatestct.com. We're opening our sites again. It's time to test. New Haven, West Haven, Stratford, Stamford, and Greenwich, and Pound Ridge. We have 30 more days of this emergency order in New York State. We're going to take advantage of it by bringing testing to the people in our testing vans and at our testing sites. You can register at coronatestct.com. Stay safe, everyone. Stay safe. Mask up, be safe. If you're living in a cornfield, I know I grew up in rural Pennsylvania, you probably don't need a mask in the cornfield. But if you're gonna sit at home for a family dinner and everyone had some sort of exposure, don't think that vaccine by itself will keep you from spreading it to your family. This is Dr. Murphy, Murphy Medical Associates, and our team at coronatestct.com. I'm signing off. Stay safe. Our bodies are made to be well. And I'm praying that the old YT doesn't do the old book burning of me. Wish me luck. Love you guys. Stay safe. I'll try and put more podcasts as I can go through. You can watch me at Odyssey. You can watch me at Odyssey where these videos are cloned. Be safe. Today's date's July 30th, 2021. Delta's coming. It's ripping through the South. In a couple of weeks, we may be in lockdown again. Stay safe, get supplies, don't go crazy, keep a cool head, get some sun, get outside, enjoy your time. And be good to each other and do your best. Love you guys. Take care. You've just watched Murphy's Medical Minute. With